Kindred Healthcare said today it will buy rival RehabCare for about $900 million. The main driver behind this deal, added costs from the new healthcare law. Bloomberg Shannon Pettypiece is here with Kindred CEO Paul Diaz. An exclusive interview. Shannon.
Thanks, Paul, for joining us early here in the morning. I want to talk to you about this health reform topic. It's been a big topic on everyone's mind. So how's that impacting this deal, your decision to make this acquisition?
Well, we're certainly seeing a lot of activity in the wake of healthcare reform, particularly in local markets, as people are thinking about how do we better manage care of patients, how do we reduce rehospitalizations, how do we reduce costs and keep people well. And we think that this is an opportunity that really goes to that. We've got great opportunities for our patients, and it provides a great platform for growth for our shareholders.
So are you facing new cost pressures because of health reform? Is there a need for you to sort of drive down costs here?
No question. I mean, I think everyone's being asked to think about how we can be more efficient, and there are significant synergies here, particularly away from the bedside. I mean, what we hope to be able to do is deploy more technology so our nurses and physicians and therapists can spend more time with our patients, and at the same time take the costs from back office operations and purchasing, out of the system.
Now, is the need to drive down costs, is that because Medicare and Medicaid want to give you lower rebates?
It's a big part of the healthcare reform was significantly lower payments for us forecasted over the next decade, and it's a difficult thing when you're trying to maintain a competitive wage rate when your cost of living increases, essentially your market basket increases are 1.5–2%. So it's a very tough reimbursement environment, and certainly that's one of the opportunities here is to try to hedge against that a little bit.
Now, you're a very large operator of these long-term health care facilities and nursing homes, and now this will add sort of this rehabilitation aspect to it, right? How does this change your business model in any way?
Well, it really doesn't change it. We've been really pivoting towards a much shorter stay model of almost 60% of our patients today go home in less than 30 days. And that is in our nursing and rehabilitation centers, as well as our long-term acute care hospitals, where we care for very medically complex patients recovering from strokes, as we talked about, or multiple chronic conditions. The challenge for us now and the opportunity is to get people home faster and to keep them home. And over the next few years, we hope to extend our home care services so we can continue the care beyond the hospital setting and really be part of that better integration of healthcare services.
Well, dealing with this long-term care type of facilities, is your main customer the government? Is Medicare and Medicaid the one that's paying for most of this?
Medicare is a big customer. We also do a significant amount, almost 30% of commercial insurance as well. So increasingly, our value proposition of moving people more quickly out of more expensive short-term acute care hospitals, whether into our nursing and rehab centers or our inpatient rehab facilities with our new partners at RehabCare, or our long-term acute care hospitals, involves a broader group of payers, customers.
Do you see any changes coming to this healthcare reform bill?
Well, I think the changes will continue to evolve. I mean, I think that between now and 2014 and beyond, we're going to see a great deal of innovation, and I think healthcare reform certainly been a catalyst for it. I think we're seeing most of the innovation begin to happen at the local level, though. What physicians, hospital systems, and other providers like we at Kindred Healthcare are looking to do and will do, I think, over the next decade.
Well, Paul, it was very good talking to you.